NCLEX RN Quizlet 2026 questions to practice smarter with proven methods. Question 1. A patient has a history of respiratory infection, Legionnaire's disease, and multiple sclerosis, MS. For which condition would the nurse question the administration of erythromycin? Option A. Recent bacterial respiratory infection. Option B. Past episode of Legionnaire's disease. Option C. Family history of campylobacteriosis. Option D. Long-standing diagnosis of multiple sclerosis. The correct answer is option D. Long-standing diagnosis of multiple sclerosis. Erythromycin is an antibiotic used for bacterial infections. It has no therapeutic role in treating multiple sclerosis, which is a neurological autoimmune disease. Question 2. Based on a history of hyperkalemia, which of the following symptoms reported by the patient would the nurse consider unrelated to an acute episode? Option A. Decreased HR. Option B. Paresthesias. Option C. Muscle weakness of the extremities. Option D. Migraines. The correct answer is option D. Migraines. Hyperkalemia, high potassium, affects muscle and cardiac function, weakness, bradycardia, paresthesia, but is not a cause of migraines. Question 3. A patient is suspected of having diabetic ketoacidosis, DKA. Which of the following symptoms reported by the patient would the nurse consider atypical for this condition? Option A. Persistent nausea and vomiting. Option B. An insatiable feeling of thirst, polydipsia. Option C. A noticeable increase in weight over a short period. Option D. A distinct fruity odor on the breath. The correct answer is option C. A noticeable increase in weight over a short period. DKA typically causes dehydration and fluid loss, leading to weight loss, not a short-term increase in weight. Question 4. A nurse suspects acute meningitis in a patient. Which of the following symptoms reported by the patient would the nurse consider not expected for this condition? Option A. A sudden increase in appetite. Option B. Episodes of vomiting. Option C. High fever and chills. Option D. Sensitivity to light, photophobia. The correct answer is option A. A sudden increase in appetite. Meningitis typically causes nausea and a lack of appetite, anorexia, not an increase in appetite. Question 5. A patient has red, itchy eyes with a yellowish discharge. Which microorganism is most likely responsible for this bacterial conjunctivitis? Option A. Yersinia pestis. Option B. Helicobacter pylori. Option C. Vibrio cholerae. Option D. Haemophilus aegyptius. The correct answer is option D. Haemophilus aegyptius. Haemophilus aegyptius is a common causative agent of acute bacterial conjunctivitis, pink eye. Question 6. A patient with a bullseye rash and joint pain has Lyme disease. Which microorganism is responsible? Option A. Borrelia burgdorferi. Option B. Streptococcus pyogenes. Option C. Bacillus anthracis. Option D. Enterococcus faecalis. The correct answer is option A. Borrelia burgdorferi. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted through the bite of infected black-legged ticks. Question 7. An 87-year-old female has increased confusion, falls, and mild left hemiparesis. Which test is most likely to be performed? Option A. CBC, complete blood count. Option B. PCG, electrocardiogram. Option C. Thyroid function tests. Option D. CT scan. The correct answer is option D. CT scan. Sudden onset of hemiparesis, weakness on one side, and confusion in the elderly necessitates a CT scan to rule out a stroke or intracranial bleed. Question 8. An 85-year-old male is losing mobility, gaining weight, and runs the heater even on warm days. Which test is most likely to be performed? Option A. CBC, complete blood count. Option B. PCG, electrocardiogram. Option C. Thyroid function tests. Option D. CT scan. The correct answer is option C. Thyroid function tests. Weight gain, lethargy, and cold intolerance, running the heater, are classic symptoms of hypothyroidism, requiring thyroid function testing. Question 9. A 20-year-old college student is found unconscious with a fever and a rash. Which of the following tests is most likely to be performed first? Option A, blood sugar check. Option B, CT scan. Option C, blood cultures. Option D, arterial blood gases. The correct answer is option C, blood cultures. Fever, rash, and altered consciousness in a young adult suggest meningococcemia or meningitis. Blood cultures are a priority for identifying the pathogen.